Happy Friday, Baylor College of Medicine. It's yet another week gone by in this never-ending joy of the COVID-19 pandemic. I don't know about the rest of you, but I'm beginning to fall into sort of a more regular cadence of dealing with this. I'm not saying I'm getting to normal, but I'm getting back to at least being able to tolerate my existence with this thing. Helped a lot by morning walks. I'm doing a lot of morning walks with Lily, and I'm happy that I've run into many of you out there on my walks, and I really appreciate when everybody says hello. I also want to thank you for the many suggestions about my glasses, and it's been very helpful. I think people forget that communication is two ways. I'm always happy to hear from you. Anytime you want to send me suggestions about anything, don't forget to send it to president@bcm.edu. I'm always happy to hear from you about anything you want to talk about. So please don't forget that. Today we're coming to you from the Student Success Center. This is where our students often come and congregate and get advice and work. Today I want to particularly thank our affiliates because our students are going back into the clinical rotations. And I thought it'd be really interesting to think about why Baylor is so special. It may not be obvious to everyone, but the fact that we have so many affiliated hospitals to train in makes all the difference in the world in preparing our students for success in the future. So if you think about it, for example, our first affiliate was the DeBakey VA Hospital. Very different. It's a federal hospital, capitated environment, different patient population. Then we affiliated with Jefferson Davis, which is now Harris Health. The Harris Health System and Ben Taub Hospital in particular is a safety net hospital. Different model of reimbursement. It's basically taxpayer money that supports that hospital system, and a very different patient population. We also have Texas Children's Hospital, I think the finest children's hospital in the world. And it's, again, a different model, combination of commercial payers, but also a lot of Medicaid and CHIP. And they also have a health plan, and Texas Children's is a quaternary facility as well as taking care of all kinds of primary care. So again, a different model. And then we have Baylor St. Luke's Medical Center, which is our fee-for-service kind of adult hospital, although we do have a significant Medicaid population as well. We don't want to forget Children's Hospital of San Antonio, a very unique and wonderful hospital in downtown San Antonio, a special patient population that's very important for our trainees. And TIER, the rehab hospital, and Menninger Clinic. So these are all very important and different. And because of the different experiences, our students get an incredibly diverse training opportunity. And they're in different environments. And those environments allow them to then go on and be familiar with any place they go. We have full-time hospitals and we have open staff hospitals. So it's really a great training environment. Now, there may be something you don't know about me. My father was not a physician. My father was actually a musician. Sounds like physician, but not. Really not. And he was in the public school world. He actually introduced the Suzuki method of violin instruction in the inner city of Detroit when he was head of music in the Detroit Public Schools, and he went on to become chairman of music education at Indiana University, which is why I went to IU Med School. The reason I mention that is his area of expertise was being a conductor. And the great thing about being an instrumentalist is that you can put together all these different instruments and create fantastic symphonies. And I really liken our training program to being in an orchestra. Yes, you have a great oboe section or great violinists in each of the areas. Each of the hospitals have their specialty feel. But it's the combination of all of these that produce the symphony that is Baylor College of Medicine's great training environment. Now, there is a disadvantage to this. The disadvantage is, as a faculty member, if you are geographically based at one of these different facilities, it's hard to remember that you're part of an orchestra. And particularly if you're a violist, I don't want to comment, but everybody makes fun of violists. But if you're in the viola section, it's hard to remember you're part of an orchestra. So it's really important that no matter where you are geographically, whether you're in San Antonio or the Children's Hospital or the VA or in a safety net hospital or at Baylor St. Luke's, you have to remember we're all part of the Baylor community. That's what makes our institution great. That's what makes the clinical training so fabulous, and why our trainees are so great. It's because they've had all these varied experiences, but together we make the best training program you can possibly get in the United States. So it's been a great week for us. Really happy that the students are getting back, and I think this week is going okay in terms of numbers. Little bit increase in the total number of hospitalizations in the Texas Medical Center, but not enough to be really alarmed yet. But still, we're all obviously cautiously optimistic that we'll get through the summer. In closing, I want to just highlight something. We, at graduation, usually have the physicians stand up and do the physician's pledge. It's a modified oath of Hippocrates. And, each graduation, I enjoy doing that and standing up and doing it again for myself, but it's really hard to feel personal about it. Because of the issues around having to have a virtual graduation, each of the students actually did this in their own homes, and we got an opportunity to do a collage of all of them. And in some ways, I think it's a lot more powerful to see each individual person standing up and doing the pledge and then collectively. So we're going to close with that. And then the other thing I wanted to close with this week is, I don't know about the rest of you, but the incongruity of what's going on is really remarkable to me. It has been an absolutely spectacular spring. Flowers are blooming. I see the birds on North and South Street, the herons that are in town. It's almost like nothing's going on, and yet we're in the middle of this pandemic. But I wanted to close with some of the beauty of the spaces and nature that we've been able to see in the spring, because we can't forget it really has been beautiful weather and fun to be around. So have a great weekend. I hope everybody got a chance to relax over the holiday. I certainly did, and I'm feeling a lot more refreshed. And I think it's really important that we all take some time, as I mentioned, in this period of COVID-19 to get some time for ourselves. But have a great weekend. Baylor College of Medicine is a fantastic place to be. I want to thank all the faculty for everything you do, whether it's doing clinical care, teaching, or research. You are what makes our institution great. Thank you, Baylor College of Medicine. Thank you, and thanks. Have a great weekend.
As a physician,
I solemnly pledge to dedicate my life to the service of humanity.
The health and well-being of my patient will be my first consideration.
I will respect the autonomy and dignity of my patient.
I will maintain the utmost respect for human life.
I will not permit considerations of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing, or any other factor to intervene between my duty and my patient. I will respect the secrets that are confided in me even after the patient has died.
I will practice my profession with conscience and dignity and in accordance with good medical practice.
I will foster the honor and the traditions of the medical profession.
I will give my teachers, colleagues, and students the respect and gratitude that is their due.
I will share my medical knowledge for the benefit of the patient and the advancement of healthcare.
I will attend to my own health, well-being, and abilities in order to provide care of the highest standard.
I will not use my medical knowledge to violate human rights and civil rights, even under threat.
I make these promises solemnly,
freely,
And upon my honor.